Hey everyone, I'm Dr. Rohanti, and recently I've been getting a lot of questions from my family and friends in India about testing for COVID in the current situation. So in this video, I'm going to take you through some of the recommendations for testing, depending on your symptoms and your exposure to COVID, as well as explain some of the common tests like PCR, CBC, and CT scans. So before we get into it, I want to explain why this video is specific to India. Firstly, because the Indian healthcare system is under a lot of stress right now, just from the sheer volume of COVID cases, and we have very limited resources, so we need to use them wisely. And second of all, unlike other countries around the world, in India, non-healthcare professionals can get access to investigations like X-rays and CT scans without them being prescribed by a medical professional. So it's really important that you know the benefits and risks of getting these tests. Most of the information in this video is in line with the guidelines and recommendations on the AIIMS website, and is also in line with the practices of some of the larger hospitals in India as shared by my medical colleagues. I've put in the links to the AIIMS COVID portal in the description of my YouTube video if you want more information, so please do check that out as well. So right now you need to know that people who are suspected or confirmed to have COVID are being categorized into 3 categories depending on their symptoms: mild, moderate, or severe. And this categorization is based on 2 things. First is your breathing rate, and the second is your oxygen saturation. So your breathing rate is the number of breaths that you take per minute. So one inhalation and exhalation is counted as 1 breath. So an average healthy young individual would have an average of 16 to 20 breaths per minute. Oxygen saturation is the amount of oxygen in your blood. And in an average healthy individual, it should measure 95% or more when you measure it using a pulse oximeter, which is a device that looks like this, and you place it on your finger and it measures the amount of oxygen in your blood. In certain conditions like long-standing lung diseases, people who have these conditions could have a generally lower oxygen saturation even if they don't have an infection. But unless you've measured your oxygen levels before and you're confident that a lower value is normal for you, it's really hard to say that anything below that 95% is okay. So do be mindful of that. So coming back to the categories, mild disease is where you have upper respiratory tract symptoms. So things like a runny nose or a cough, and you may also have a fever, but definitely without shortness of breath or a drop in your oxygen saturation. If your breathing rate is more than 24 breaths per minute, or your oxygen saturation is less than 93% while you're in room air, that classifies as moderate disease. And if your breathing rate is more than 30 per minute, or your oxygen saturation drops to below 90%, that is categorized as severe disease. By the way, if your oxygen saturation drops even with a little bit of exercise, like walking around the room, that also counts as a drop in your oxygen saturation. So now that we know the categories of COVID severity, let's talk about what it actually means in terms of action. For people who meet the criteria for moderate or severe disease, the recommended option is admission to hospital. So there's no talk of testing here because any test or treatment that you need will be done according to the guidelines while you're in hospital. For people with mild disease who are over the age of 60 or have any medical conditions that can worsen the effects of COVID, like long-standing heart, liver, lung, or kidney diseases, or any conditions that can affect the immune system, the recommendation is to be monitored in a COVID care center. If you don't have any COVID care centers in your area, then you should get help from a doctor who should guide you on the resources available for monitoring, and they'll be organizing any tests that you need as well. So if you don't have any symptoms, or you're below 60 and have mild disease without any of those medical conditions I mentioned earlier, then the recommendation from AIIMS is to isolate at home, regardless of whether you've had an exposure to COVID or not. And there's no recommended testing at this point because everyone is assumed to have COVID and we act in a way that prevents any further spread. But I know it can be really hard to stay at home and not do anything. And sometimes you just really want to know whether you've been infected or not. So be patient with me and I'll take you through some of the tests that are available and the monitoring that you can do. So if you meet this criteria of no symptoms or mild disease under the age of 60 and you absolutely want to get tested, I recommend doing the RT-PCR test. So this is a swab of the nose and the throat. And basically what it does is it's looking for genetic material of the virus. And if the test is positive, that means the genetic material has been detected and you can take that as a sign of infection. But more importantly, you should know that a negative test doesn't always mean you don't have the infection, because there are many different factors that can cause a negative test even if you have the infection, like the timing from when you were infected and when the test was done, or even just simple machine errors. So if you get a negative test, it doesn't mean you skip home isolation. It just means that you don't have a test that proves infection. People have also asked me about what a CBC and CRP are and whether they should be getting these tests. So these are blood tests. CBC stands for complete blood count, and it looks at your red and white blood cells in your blood. And a CRP stands for C-reactive protein, which is an inflammatory marker. Now, if you have any infection or inflammation, usually your white cells, which are involved in your immune response, will go up. And similarly, your C-reactive protein, which is a sign of inflammation as well, will also go up. But you need to know that these markers are not specific to COVID. So you can have COVID and you can have no symptoms or very minimal symptoms, and you can still have a normal white cell count and a normal CRP. Similarly, if you have some other infection going on, like a urinary tract infection, or you have a flare-up of your arthritis, which causes inflammation, your white cell count and CRP can go up as well. So generally in this situation, doctors are using the CBC and CRP together with other tests, usually to see if you're responding to treatment. So if you order these tests yourself, they're probably not going to tell you much. So if you do get them, just make sure that they're being interpreted by a doctor. So the last thing people ask me about is imaging or scans. So you've probably heard the word CT chest a lot during this time. So doctors used CT chest scans to assess how severe the infection is and the extent of damage that has occurred to the lungs. A CT scan is just a high-resolution version of an X-ray. And they're really good at what they do, but it also means that they have a really high dose of radiation. So a CT scan gives you about 70 times the radiation dose that an X-ray does. So does that mean you need to avoid CTs altogether? No. Well, in medicine, we always use this concept of risk versus benefit. And if the benefits of doing a particular test or getting a treatment outweighs the risks, then we recommend that test or a treatment. So in people who we're suspecting a more severe form of the disease or ones that belong in the high-risk categories that I mentioned earlier, the benefits of doing the scan outweigh the risks. But exposing someone who is healthy and young with little symptoms unnecessarily to such a high dose of radiation and increasing their cancer risk is probably futile, and the results are not going to offer much. So unless you've been assessed by a doctor and actually recommended to have a CT chest scan, it's not advised that you get one yourself. And with X-rays, yes, the radiation risk is a lot less, but like I said, it's also low resolution. And if you have severe enough disease that's going to cause changes on your X-ray, then you probably have severe enough symptoms to match that level of disease as well. So doing an X-ray is not going to give you much, and it's, again, probably better off saved for people who actually need it. So if you met the criteria for home isolation, stay at home and keep a close watch of your symptoms. Watch out for shortness of breath, and also measure your oxygen saturation at least 4 times a day. And if you notice any shortness of breath or drop in your oxygen saturation that stays low, get medical attention immediately. Thank you for watching this video until the end. I hope it answered some of your questions about testing for COVID. Please feel free to share this video around with those who need it. And if you have any other questions you'd like me to answer, please find my YouTube channel. It's called For Fact's Sake, and post your questions as comments there and I'll respond with the video. I just want to end this video by saying that we're incredibly grateful and proud of all our healthcare professionals who are working their hardest at this time. Please help them in any way that you can, even if it just means postponing your trip and staying at home. It really makes a difference. Thank you.